maps to some incredibly precise physical and even emotional symptoms. Let's just jump right in and break down the science, the history, and the exact clinical applications of this incredible plant. To make sure we cover everything efficiently, here's our agenda for today. 1. Origin and keynotes. 2. Applications for female health. 3. Warts, joints, and males. 4. Triggers and relief. And 5. Dosage and safety guidelines. All right, Section 1, Origin and Keynotes. So, Sabina is a homeopathic medicine derived from the roots of a conifer plant. Now, what's historically wild here is that back in ancient times, this plant's roots were actually known for their use in inducing abortions. Because it has such an intense, powerful action on the reproductive organs, it was, well, incredibly dangerous when used in its raw herbal form. But in homeopathy, through careful dilution, that exact same affinity for the reproductive system is harnessed to heal rather than harm. This historical backdrop perfectly sets up its main clinical focus. Now, this brings us to an incredibly unique keynote symptom that literally jumps out of the source material. Ready for this? Turn down the music. It's causing me palpitations and anxiety. Yes, a Sabina patient often physically cannot tolerate music. When practitioners take Sabina cases, patients frequently say that if loud music is playing, they get hit with severe anxiety, palpitations, and this weird sensation right in front of their ears. They'll literally yell at their family to shut the music off. This profound intolerance to music runs through the whole shebang, regardless of whatever physical ailment they're actually trying to treat. Beyond hating music, this builds a very specific core patient archetype. The Sabina patient runs incredibly hot. They sweat easily and absolutely loathe closed rooms. Like they constantly need to open windows and doors just to avoid feeling suffocated. Physically, the big red flag for this remedy is significant fluid loss, whether we're talking about blood or semen. And when they do have pain, it follows a very strict path, radiating straight from the sacrum, the base of the spine, all the way through to the pubis in the front. Keep this image of the hot, fresh air craving patient in your head as we keep going. Section 2, Applications for Female Health. This brings us to the real heavy hitter for this remedy, the female reproductive life cycle. Sabina actually treats women across their entire chronological lifespan. For young girls, roughly 10 to 14 years old, it's used for early puberty or early menarche, especially when those very first periods are insanely heavy and prolonged. Then jump to the 20 to 35-year range. Here it steps in for difficult pregnancies, severe painful periods, and uterine fibroids. And finally, looking at the 45 to 55 age bracket, it is highly effective for menopause, specifically when those hot flashes and all that heavy sweating are paired with that sudden extreme intolerance to music we just talked about. Let's drill down into those specific female ailments. Sabina is an absolute powerhouse for dysmenorrhea, which is severe painful menstruation, and menorrhea, meaning incredibly heavy, prolonged bleeding. It's also a go-to remedy for uterine fibroids. In fact, in cases where massive fibroids cause dangerous bleeding or block a woman from conceiving, Sabina can sometimes be a real game changer, potentially preventing the need for a hysterectomy. Plus, it targets a very specific leukorrhea, a white discharge that is acrid, burning, and itching, specifically when it shows up exactly 10 days after a period ends. The timing there is absolutely crucial. Now, here's where the precision of homeopathic medicine just blows my mind. We're doing a quick differential diagnosis on miscarriages. Sabina is famous for preventing recurrent miscarriages, but specifically, and I mean literally specifically, those occurring in the 3rd month of pregnancy. That's right before the placenta fully takes over. If a woman is having miscarriages later on, say between the 5th and 7th month, a practitioner would actually look at a totally different remedy, sepia. Or if it's happening in the 8th month, the remedy viburnum is the one. This level of exact symptom matching is what makes this system so unique. 40 days. So why is this specific number so important? Well, in the postpartum phase, the uterus goes through a process called involution, right? It shrinks from a massive abdominal organ back down to its normal pelvic size. But if this process drags out and the uterus hasn't bounced back to normal after 40 days, Sabonina is the primary medicine used to speed that involution right up. It's also incredibly effective in helping the body expel or retain placenta immediately after delivery. All right, Section 3, Warts, Joints, and Males. So you might be wondering, does Sabina only treat women? It's a super common misconception given its massive uterine focus. But the answer is a resounding no. When the underlying archetype matches, remember that hot-blooded, open-air-seeking profile? It has surprisingly powerful applications for males and for general structural pain too. Let's check out its broader applications. For joints, Sabina tackles gout pain, specifically in the small bones. Think toes, ankles, and metatarsals, which actually looks a lot like another remedy called Ammon Foss. Moving to the skin, it targets painful fig warts, which honestly sounds exactly as uncomfortable as it is. They're warts that hang off the skin by a tiny little stalk. This makes total sense though, because Sabina is in the exact same plant family as Thuja, the undisputed king of homeopathic wart remedies. For males, it treats things like gonorrhea with highly acrid discharge, venereal warts, and a painfully retracted prepuce. And for both sexes, it's a key remedy for abnormally increased sexual desire or nymphomania. Let's head into section 4, triggers and relief. In the homeopathic world, we call these modalities. It's basically the rules of what makes a patient worse or better. Sabina patients are heavily aggravated, meaning their symptoms flare right up by loud music, general heat, and being stuck in a warm, closed room. Conversely, they experience amelioration. They feel so much better in the open air, when consuming cold things, or when slapping some cold water directly onto those painful gouty joints. Interestingly, they also feel way better when they're up and walking around rather than just sitting still. It all perfectly mirrors that hot archetype we built earlier. And finally,